Hello, I'm Dr. Stephen Bailey. I'm a neurosurgeon with Mayfield Brain and Spine. I'd like to talk to you today about trigeminal neuralgia, a pain syndrome that can be terribly disruptive of people's lives. I became interested in treating trigeminal neuralgia during my training at the Medical University of South Carolina and here at Mayfield. Both programs treat a great many patients with trigeminal neuralgia, and I've experienced real satisfaction from helping patients recover from this very painful condition. Trigeminal neuralgia is an irritation of the trigeminal nerve which provides sensation to the face. This condition typically affects one side of the face and can occur anywhere from the jaw to the forehead to the area around the eye. It typically begins with brief but very intense shocking sensations, which can be triggered by pretty innocuous activities, things such as brushing one's teeth, chewing, talking, or even a draft of cold air that strikes the face. Trigeminal neuralgia can be completely debilitating. We see patients who can no longer work, who can no longer perform normal activities, things such as chewing, swallowing, shaving, or washing their face. Trigeminal neuralgia can be associated with a few diseases such as multiple sclerosis, but in most cases it is idiopathic. This means it simply develops without known cause. It's possible, though not proven, that genetics may play a role in the origin of trigeminal neuralgia. During the early stages, trigeminal neuralgia can be managed with medications, but as time goes on, the medications can lose their effectiveness. At Mayfield, we treat patients whose trigeminal pain is no longer controlled by medications in one of three ways. The first treatment is called a microvascular decompression, or MVD. An MVD is a form of open surgery in which a craniotomy or opening is cut into the skull. This exposes the trigeminal nerve where it leaves the brainstem. During this procedure, we look for a blood vessel that may be compressing or sitting against the nerve and causing pain. We then separate the blood vessel from the nerve and insert a cushion. This procedure is performed in the hospital. Patients typically spend 1 to several nights in the hospital after surgery. The second treatment is called percutaneous stereotactic radiofrequency rhizotomy, or PSR. This is a more minimally invasive treatment, and it's performed at our Mayfield Outpatient Surgery Center. During this procedure, I place an electrode through the skin of the cheek and into the nerve where it exits the skull. Our goal is to cause some controlled damage to the portion of the nerve that is involved in the distribution of pain. Patients who undergo a PSR go home the same day. The third treatment involves radiation. The goal of radiation treatment is also to cause some controlled damage to the trigeminal nerve root in order to interrupt pain signals from reaching the brain. Stereotactic radiosurgery is a non-invasive outpatient procedure that uses highly focused radiation beams to destroy some of the trigeminal nerve fibers that produce pain. Radiosurgery is delivered by systems such as the Lexel Gamma Knife or linear accelerator systems such as the BrainLab Novalis. A stereotactic head frame or face mask is attached to the patient's head to precisely target the nerve and to hold the head still during treatment. Highly focused beams of radiation are delivered to the trigeminal nerve root over a period of about an hour. With this procedure, pain relief may not occur immediately, but rather gradually over time. A majority of patients will eventually experience improvement of their pain, although some may continue to require pain medication. How do we decide which treatment to perform? Many patients have more than one option, so we take several things into consideration. These include previous treatments, any additional health conditions a patient has, and certainly patient preference. Oftentimes, the hardest part of this condition is receiving the correct diagnosis and getting to the people who are able to help you. Once a patient gets to the right clinical practice, like Mayfield, their trigeminal pain is quite treatable. When I see patients with trigeminal neuralgia, their biggest concern is usually, how quickly can I get relief? I tell them that their condition is a priority, and we will expedite their care as quickly as possible so they can get back to enjoying life. I hope this has answered your questions about how we treat trigeminal neuralgia at Mayfield Brain and Spine. To learn more, please visit us at mayfieldclinic.com.